Hey guys, so today we'll discuss another disease which is a Graves disease. This is also a thyroid disease, but this one it is autoimmune. So this is a autoimmune means here against the thyroid antigens antibodies are formed. Our body produces antibodies against this thyroid antigens. So because of this Graves disease is coming. So why, what, this all we will discuss now. So Graves disease. Graves disease means it is also known as Basido disease. Basido disease. So the most common cause of hyperthyroidism. So Graves disease is the most common cause of hyperthyroidism. So in this we have triad. What triad we have in this Graves disease is, first thing is hyperthyroidism. Just now we told like it is the most common cause of hyperthyroidism. So triad clinical features include, first one is hyperthyroidism. Another one is the people will be exophthalmos. Exophthalmos means their eyes will be protruded out. So normal people have normal eyes, but here they have protruded eyes. And another one is pretibial myxedema. So these are the three clinical features which forms the triad for Graves disease. One is hyperthyroidism, exophthalmos, protruding eyes, and pretibial myxedema. And it is most commonly seen in females. Females, and etiology is genetic. Genetic means it is mainly seen in monozygotic twins. Means if both are twins, and if one person have, another person will surely get this disease. So this is a genetic disease. And pathogenesis, it is an autoimmune disease. So characterized by presence of multiple autoantibodies, most important against the TSH receptor. So pathogenesis is, just now I told you, it is an autoimmune disease. So in this autoimmune disease, what will happen in autoimmune means antibodies are formed in the body against the thyroid gland. So which part of the thyroid gland it is formed? Against the TSH receptor. TSH receptor against autoantibodies are formed. So this is the pathogen. So what are the autoantibodies? Just now we told like autoantibodies are formed. Now what are the autoantibodies that are formed? So autoantibodies that are formed is, first one, thyroid stimulating immunoglobulins. Thyroid stimulating immunoglobulins, thyroid growth stimulating immunoglobulins, and TSH binding inhibitor immunoglobulins or anti-TSH receptor antibodies. So three antibodies are formed, autoantibodies, that is thyroid stimulating immunoglobulins, thyroid growth stimulating immunoglobulins, and TSH binding inhibitor immunoglobulins. So now let's see what they are doing to our thyroid gland. So normally there is a normal epithelium, and so means normal thyroid gland have normal epithelium. Just now we told it is mostly genetic. So now we have, so because of failure of self tolerance to autoantigens, because of failure of the tolerance to antigens in the thyroid gland, autoantibodies are produced against this thyroid gland, mainly TSH receptor. So first one we told, the first antibody is thyroid immunoglobulins, thyroid stimulating immunoglobulins. So this thyroid stimulating immunoglobulin, so let me explain. This is the normal cell. This is the normal cell, and this is the TSH receptor. Okay, this is the TSH receptor, and now thyroid stimulating immunoglobulin. Now this will come, now let's think, this is the thyroid stimulating immunoglobulin. Now this will come and bind here. This will come and bind here, and because of this there is increased production of thyroid hormone, increased secretion and release of the thyroid hormone, which causes hyperthyroidism. Hyperthyroidism. It will cause hyperthyroidism. So again we'll discuss. So thyroid stimulating immunoglobulin, what it will do? It will bind to the TSH receptors present on the cell epithelium of the thyroid gland, and it will produce the thyroid hormone. Because of this secretion of the thyroid hormone, there is hyperthyroidism. So now this is the one autoantibodies action. Now another one is what? Thyroid growth stimulating immunoglobulin. So in this word only you listen, thyroid growth stimulating means what it will do? It will increase the growth. Means if this is the normal epithelium, so what it will do is same what it will do, this is the TSH receptor, and these are the thyroid growth stimulating immunoglobulins. So what it will do is it will cause proliferation of the follicular cells. So it will cause, so normally 3 are there, and here 1 2 3 4 5 6. So here what happened? Hyperplasia. Obviously hyperplasia, increasing the number. So obviously hyperplasia occurred. So because of the proliferation of the follicular epithelium, hyperplasia of the thyroid gland occurs, which causes hyperthyroidism. Obviously, see here 3 are there, so number of the cells are increased, means the number of production is also increased. So thyroid hormone production is also increased, which causes hyperthyroidism. So here I wrote parathyroidism, sorry, which causes hyperthyroidism. So see, that's it. And now here TSH binding inhibition immunoglobulin. So here it is inhibition immunoglobulin. So this same TSH receptor. So this is the inhibition immunoglobulin. So it will come. So mainly it has two actions. One is sometimes it will stimulate the thyroid gland function, and sometimes it will inhibit the thyroid function. So because of this will bind, and actually what it will do is this receptor will bind to this TSH receptors, and it will stop actual TSH. This is produced from pituitary, actual TSH hormone. It will stop. It will competitively, it will not make binding it to the TSH receptor. So because of this will not bind, only this will bind, and it will show two actions. One is it will stimulate the thyroid function, and it will inhibit the thyroid function. So because of the stimulation we will get hyperthyroidism, and because of the inhibition we will get hypothyroidism. So we will get here, one is two outcomes we will get. One is hypothyroidism, another one is hyperthyroidism. So Graves' disease will have two outcomes. Means if people will ask you what type of thyroidism it will see, means both hypo and hyper we will see. Why hypo and hyper? One is because of the all three will get hyper, and because of the last TSH binding inhibitor immunoglobulin, it will show two actions now. When even it will inhibit the thyroid function, we will get hypothyroidism. That's it, guys. So I hope you understood this concept very well. Thank you. If you have any doubts, comment in the comment section, and if you want me to explain any other topics, please comment and subscribe to my channel.